Welcome back to Bottomline Africa. So straight away, let's head to that discussion about Africa vaccination drive. How are we doing as the African continent? Then we also narrow it down to our country here in Kenya. And joining us in this conversation, I have brilliant minds, doctors, and I'm talking about Dr. Ahmed Ogwell, who's the Deputy Director at the Africa Centers for Disease Control, that is Africa CDC. Dr. thank you for joining us here on Bottomline Africa. And also joining us from our city center studios here in Kenya, Nairobi, is Dr. Willis Hawale, Head of Vaccine Development Task Force here in the country that's dealing a lot with the vaccination drive that the government has been doing. Thank you also, Dr. for joining us here on Bottomline Africa today. But let me begin this conversation first by picking the mind of Dr. Ogwell. There is a lot of what the WHO, World Health Organization, calling as vaccine apartheid, a lot of hoarding of the vaccines by the Western countries. Yet at the same time, we are seeing the same Western countries having more than enough, and they start distributing it to African countries. Why are we seeing double standard in all this vaccination distribution?
Thank you for having me. The other side of divide is pandemic will not end if we do not global manner. If you only protect one part of the world, then you will never be pandemic. Some of these countries are hoarding.
Dr. Ogwell, allow me to cut you short. I know we're using technology to sort of try and pick your mind on this discussion, but it looks like we're having a bit of some difficulty on your side when it comes to your sound. So let me continue having this conversation with Dr. Willis Hawale as our team and also your team on your side try to sort it out so that we can get to hear your contribution clearly. I hope that is okay with you, Dr. All right, so let me bring in Dr. Willis. Dr. Willis, you are the head of Vaccine Development Task Force here in the country. We're seeing Kenya getting lots and lots of vaccines. You know, we have now Moderna, we have Johnson & Johnson. You're also expecting the Chinese vaccine here in the country. We're also expecting Pfizer. Then again, we have AstraZeneca. Why is it so hard for the government to get this vaccine directly instead of using COVAX or the AU?
Okay, thank you for that question. And let me start by really saying that this is a challenge that began right from the beginning. Following the discovery and the manufacturing of the vaccines from late last year, it was very clear that the rich countries wanted to produce for themselves. They wanted to be sure that they have adequate doses that they would use for their populations. And it then became clear that African countries would be disadvantaged. And that is why the formation of COVAX as a mechanism that brought around, 92, 93 countries, low and middle income countries, to try and increase access to these vaccines was a very welcome venture. It brought about people with goodwill and people with foresight that nobody is safe until everybody is vaccinated in this world. That was good. And at the same time, the African Union therefore came with the AVAT mechanism as well, saying that we as the African continent should not be left behind. Mm-hmm. I think the most important point here is that it is the production, it's that manufacturing. So people with money had placed excess orders, they had booked the supply chain. So even if countries had money, you try to get, you would not get a booking for that. So that is first and foremost. The supply chain was really booked, and that made it very difficult for African countries to access vaccines.
All right. So Dr. Ogwell, I understand now that you're okay. From what my director Karen is telling me, you are telling us, giving us the reasons as to why there's been a lot of vaccine apartheid, hoarding of vaccines, and this is something that WHO has raised concern about. Then at the same time, which the question was, why are Western countries hoarding the vaccines? And at the same time now we're seeing that it's like they have an oversupply of what they need, then they decide to donate some of the vaccines and use vaccines to the African continent?
Some countries have oversupply of the vaccine. They have booked and bought more than they need. While Africa, although we are ready to buy, we do not have vaccines to be able to buy now. What we are getting are vaccines that will be available later on next year, and that is too late. Now, some of the reasons we see countries profiling as for getting a lot of the vaccines is the lack of trust that if the rest of the world actually has access to these vaccines, then they too will be able to be protected. And that is the reality. If you don't protect everyone, then no one is actually safe. So we as the Africa CDC have been very clear with all the countries that are having oversupply, that if they do not make available those vaccines to all parts of the world, then the pandemic is never going to stop. And secondly is we are not asking for donations as Africa. We are actually wanting to buy those vaccines. But then our queue is, we are right at the back of the queue. And those who are in front of the queue already have enough. So what we are asking is that we change places and we are able to buy those vaccines now, and we can be able to vaccinate our people. Hoarding will not work. Vaccine nationalism will not work. And any attempt at keeping the vaccine from flowing into the rest of the world, the pandemic will also not stop.
Right. And Dr. Hawale, we are seeing, back here in the country, back here in Kenya, we are seeing the arrival of Johnson & Johnson, and owing to the fact that Johnson & Johnson is, sorry for that, is just a single jab. You don't need to get 2 jabs, and that is what majority of Kenyans are preferring than Moderna and AstraZeneca that are already in the country. So what is the plan of the government? Because we're seeing the uptake now is increasing on Johnson & Johnson.
Mm-hmm. Yeah, thank you for that question. Let me start by saying, yes, the Johnson & Johnson, first and foremost, these are, the shipment is direct procurement by government through the African Union. And the reason we really chose it is because of its ease of use at the lower levels. The storage requirements is not like the other vaccines. So it's easier to store even at a health center dispensary and therefore conduct vaccination. It isn't so much that because it's a 1 dose, then it is good for you. I've heard that, and yes, for the last 1 week, we've seen a lot of adults saying, I prefer that because it is 1 shot. But I'm surprised that children are taken to clinics several and injected several times, but the same elders don't want to be injected several times. And just to say, with these vaccines, the need for booster doses are coming. So you shouldn't have the comfort that this will be one for a very long time to come. Mm-hmm. But all the same, again, the most important point is that these vaccines, when it comes to prevention of severe disease, the need for hospitalization and death, they are equal. None is better than the other one.
All right.
But again, let me hasten to say, yes, because of the ease of administration of Johnson, we want to do more. In Kenya, we had expected 1 million doses in August, and also another million, let's say, this September. But so far, we've received only 141,000 doses, as you know. So that is definitely impacting our plans, and I hope the African Union can then hasten so that we can start getting more doses of J&J.
All right. And Dr. Ogwell, I like the fact that you're saying that, there is need for Western countries to ensure that this vaccine is equally distributed among countries globally so as to stop the severe, effects of COVID-19 infections. But then it begs the question, we are seeing some of these Western countries put some countries like Kenya on the red alert in terms of countries with variant high cases of COVID-19 and a lot of restrictions being put, but the same countries are still recording high number of COVID-19 infections and deaths. Why double standard?
Decision-making at policy level needs to be guided by science and evidence. Some of the decisions we are seeing around restrictions of travel are not guided by science and evidence. If you restrict travel from a particular country because of variants, for example, there's no science to that because the variants are all over the world. What we encourage countries out there to do is to have good surveillance systems. You can test arrivals if you want, but then to restrict people from travel is discriminatory because it is not based on evidence. Other countries that have even the higher circulation of some of these variants, indeed higher numbers of new cases, are still traveling to those parts of the world. So it is discriminatory, and we have been communicating with some of these countries that are having unreasonable restrictions to open them up, to lift those restrictions so that people can be able to travel with the guidelines that have already been put in place, a negative test within a certain period of time, and if a country wants, they can be able to do the testing when you arrive. But to restrict travel, this is discriminatory and is not based on science.
All right. And Dr. Willis, when we look at the vaccination drive here in the country, kindly break it down for us in terms of the numbers. How are we doing as a country in terms of a vaccination drive? And if the numbers are so positive, there is a lot of fear. Now, this is just two questions in one. So the first one is break it down for us in terms of our numbers. How are we doing as a country in terms of vaccination? The number two, because of time. Also, there is a fear by some Kenyans for the fact that they've seen their friends, their relatives who've gotten vaccinated, and this vaccine, it's supposed to stop the severe infections of the COVID-19. But at the same time, some of the friends or relatives end up at the ICU, and sadly, they lose their life.
Okay. Yeah, an important question. I must say that our vaccination program against COVID-19 is really gathering pace. Last week, we just released a deployment plan that will guide further acceleration for us to achieve our target of 10 million by the end of December. And as of now, as of today, we have about 3.2 million vaccinations that have been done. Out of those, about 830,000 are fully vaccinated. And we've seen a very tremendous increase in the first dose uptake, very close to 2.4 million people now have had their first vaccination. I must say it's extremely encouraging, especially for teachers. We had a target of 330,000 of teachers in public schools. We have now surpassed that target. There are 345,000 teachers who have been vaccinated. And of course, this target has been revised upwards because from the month of August, we also allowed teachers in private schools who are approximated about 150,000. So we are seeing an improved uptake. We've seen even our vaccination vaccination rate per day hit a high of 76,000 per day. And you are right, now we've brought many other vaccines, so we had to slow down, do trainings. We have now redistributed the vaccines, and we should be gathering a lot of pace in the coming few days. We are hoping that by end of September, we should be doing 80,000 vaccinations per day. Now, let me speak to the issue of the side events and say that one of the important things, the side events are minor and they are going to wave off with time. Many of them are headache, pain at the site of injection. Now, but let me speak to the fact that some people are vaccinated and then they get severe disease. It is true you get what you call breakthrough infections. You can get breakthrough infections, but the experience with those who get breakthrough infection, the clinicians are telling us the symptoms are not as severe as those who are not vaccinated. Right. The other important point to note is that, especially with AstraZeneca, remember, the body antibodies, for you to throw the immunogenicity so that you are fully protected takes time. You could be vaccinated today. That doesn't mean now you are fully protected. So we have people who are waiting until they start feeling like they may be contracting COVID and they get vaccinated. I know within the hospital it will be recorded like they were vaccinated. If you look at the period between the first and the second dose of AstraZeneca, it really takes almost 4 months for you to have the full immunity. Because after the first dose, it takes 2 to 3 weeks. And then after the second dose, another 2 to 3 weeks. So there are people who are getting breakthrough infection before they go through the entire period that the body requires to really give that full protection.
All right. And as we bring this to an end, let me get the voice of Dr. Ahmed Ogwell, the Deputy Director, Africa CDC. The uptake, the increase of COVID-19 vaccination within the African continent, what does it mean, for the economy of the African continent, especially the tourism sector that has been badly affected by the effects of the coronavirus?
Vaccination is a very important tool in getting us back to the new normal, so that we can be able to go about our economic activities as as normally as possible. So when the vaccination rates go up, it means that our economic activities will also be able to stabilize, and we can do things not exactly as we were doing them before, because we still have to maintain the public health measures, but at least with a lot more confidence that we are protected from getting severe disease. So the more we vaccinate, the better it is for the economy. Right now, with vaccination rate of 3%, we are still far from our target of 60%, and we need to work even harder to try and get those vaccines onto the continent. But vaccination will take us back to better economic activity, and therefore the economy on the continent, including tourism, is going to improve.
All right. Thank you so much, Dr. Ahmed Ogwell, Deputy Director, Africa Centers for Disease Control. Thank you for joining us here on